And just so everyone's aware, this is a virtual meeting via Zoom. And the first item obviously would have to be one of attendance. Mary, are you here?
I am.
Charlie?
Yo.
Eric?
Present.
Deborah? I believe she's not going to be present at the meeting. Director Murphy?
Yes.
Great. Okay. With that done, the first item on the agenda would be public comment. If anyone is calling in or zooming in, now's their opportunity to address the board.
Mr. Chairman, I just checked the waiting room and there are no attendees looking to have any questions, and there is no public comment on the email.
Well, that's great. Okay, we'll just move along then. So second item would be coronavirus update state actions. Director Murphy, I believe there's an extensive list of things to state. You're on.
Yes, Mr. Chairman and board members. I thought this would go on the agenda. Maybe you can show the agenda up there, Rich. Just to let the public know that some of the actions that the state has already taken, I just wanted to just show the public that. And as we can see on the agenda there, the governor extended the stay-at-home advisory to May 18th. Required mask effective May 6th. And previously, the governor had ordered golf courses closed, which that was opened up last week. But the governor had also ordered, or still has ordered, motels and swimming pools closed at the motels, restaurants inside seating, and non-essential businesses. So that's what the state is doing at the state level. So I thought that would just be a good recap leading into where Board of Health actions and enforcements and approvals of operation plans that we can go into in the next segment here. So with that, Mr. Chairman, I can go to a few graphs just to kind of show us where we're at. And I can let the people at home know that we've had 101 positive coronavirus cases since March 11th in town. We had our most one-day number of positives submitted on Friday, which was the 9th. We had 9 Saturday, 2 one Sunday, and 2 today for the 101 total positives. We're currently following 39 active cases within town. We've had 2 deaths and we've had 60 people recover. So a couple charts that we wanted to show, this chart that's up there now is the state chart on deaths within Massachusetts on a 3-day period. Next chart. That's the deaths based in just within the county health department. And it's hard because it's a smaller sample, but I just wanted to show that that's being tracked on the county level. Next chart. I think when you look at the new cases on the state website of new positive cases within Massachusetts on a 3-day period, you can see it's been increasing from the 1st of March. Looked like it was leveling off a little bit to a spike that April 22nd. So it looks like it might be leveling off. Next case, next chart. The next chart would be new positive cases every 3 days on the county level. And again, it's not as big of numbers. So it's hard to really get a trend on this, but it looks like it could possibly be leveling off also. Next chart. This is a Yarmouth chart of, just go down just a smidge, there you go, of positive cases that we've had since our first case of March 11th on a 7-day period. If you could just explain this chart, Mr. Chairman.
it possible to see the entire right side of the graph there? Let me just bring it over. Okay, so essentially you have a bar graph there. Those are the blue vertical lines, and then you have a line running across the graph. And the blue ones are essentially the number of positive cases we see every day in Yarmouth. So obviously most days we have cases, and the linear orange line is essentially an average that's done on a weekly basis. So I'm not sure if we're leveling off. It's been level for a while, and then we certainly have had a spike recently. It's important to keep in mind that different parts of Massachusetts, different parts of Barnstable County, they'll probably have their own increases and decreases and spikes. Cape is pretty unique that way. It's pretty separate, and we obviously rely on tourism, so it's still early here. So I imagine we'll see some major changes as time goes on.
Okay,
What else do we have there?
thank you. We'll go to the next shot, and then how do I get the people's picture back up here? Am I, oh, minimizing? No. Okay, you can roll up the next shot. Oh, can you twist that one?
Great.
This next chart just shows a town-by-town comparative of the Cape towns. And 2, 3, it just shows where the number of cases are based on a average rate per 100,000. And, you know, it started, the state does this each Wednesday. They list the town cases each Wednesday. And we've looked at putting something together since April 14th, April 22nd, 29th, then last week, May 6th. So based on the average rate, you can see Yarmouth has been doing fairly well the first 4 weeks right here with a lower rate than several of the towns. You can see we had the 5th, 6th, 7th lowest rate of all the Cape towns based on the number of positive cases and our average rate.
Is the rate per 1,000, does that refer?
100,000.
100,000.
Okay. Does that refer to the total number of positive cases or the current positive cases?
The current positive cases, I list the current positive cases right next to the town. So you can see when we started on April 14th, we had 42. The following week on the 22nd, we had 52, 29th, 65, and last week we had 80. So
It's cumulative,
correct,
excuse me.
correct, cumulative. So just to get an idea what you can see townwide. Okay, next chart. The next chart will be on the demographics breakdown, and I'll let the chairman just discuss a few points on that.
On the demographics, I'm not sure what you're saying, Bruce.
Oh, just when it comes up here,
Oh, okay.
next chart. This one right here, if you wanted to say anything about the, can you get it all in one sheet? Just, we just wanted to show what the age breakdown is, and then go a little bit more to get the totals in male, female. So it's pretty well spread over a little bit in some of the brackets, age brackets.
Seems, pretty consistent. We're certainly seeing more in the, 40 to 70-year-olds than may have been anticipated, considering long-term care facilities and so on, but it seems pretty consistent. It's in the middle of the list, seems to be where most of the patients are.
We've been very good. We've not had any clusters in our nursing homes, long-term care facilities. We've not had any clusters in our facilities at this time. You want to just go down a little bit more and show the breakdown of male, female? There we go. So a little bit more female coming in than male when we look overall. Okay, we can go to the next base coming on. How did that keep? Yeah, you can keep. See what you have next. I think you can keep rolling.
We're up to what, item number 3 then?
Yeah, I think we can go right into item 3. I think Rich can probably call up the past Board of Health order of April 1st.
Could I ask a question?
Certainly.
I'm curious, do you think, is Wellfleet reporting, do they truly have under 5 cases still?
Yes, they have. These reports
Official?
come right in from the state. So that's what they're reporting through the state tracking program. That's correct.
Okay. And
Period.
I think it's kind of remarkable we've only had 2 deaths.
Yes.
Does that surprise anybody else?
It does me, considering
Yeah,
the age of our population here.
right.
As for Wellfleet, it may really have to do with density. People have
Yes.
a lot of space there. And
Right.
so we know all the hotspots have been, very dense ones, whether it's a factory or it's a major city. And so
Right, right.
Wellfleet has an advantage on the rest of us.
Right. Not much of a downtown.
Got it.
Okay, thank you.
So I think our order's right at the very beginning. It might have been the first before the graphs, right here. Yeah,
Right.
there we go.
Okay. So this is a listing, I guess. The first item A here is the emergency order that this board put out on April 1st. And as you can see,
Want to just scroll down so you can read a little bit.
yeah, it was in order,
There you go.
basically affects the following activities, which I can read, just the record, and that had to do with town buildings closed to the public. Senior center is closed, and that was except for the kitchen for the Meals on Wheels and the food programs. The libraries were closed, and all the town recreation activities were closed also by that order, and that included the golf courses, pickleball courts, tennis courts, basketball courts, youth activities, parks, beaches, and Grady's Beach Boardwalk. Once again, that went into effect on April 1st. Next on that list is, well, Director Murphy, you may want to go down that list a little bit. First, is the natural resources there. Can you pick
Okay,
it up?
the next program that we're going to discuss was the opening plan for the boat ramps with Department of Natural Resources. And I'm just trying to see if we had a little something in the packet there, I think.
I didn't see anything.
Yeah, I think that came separate.
It did. On natural resources from Carl,
Yes, but I'm not sure we have
it came separately.
yeah, I'm not sure we have a list to plug it up tonight on the screen. But it came separately from the Director of Natural Resources, following the state guidelines for opening boat ramps. He has posted the appropriate social distancing of people when they're launching their boats, in their boats, no tie-up of boats. So that was reviewed with the Director of Natural Resources when the state came out with their opening plan back April 27th. after reviewing the plan with the Director of Natural Resources and the chairman, I agreed that that would be fine to go forward, and I would just bring it to the board's update today. And I did talk to the Natural Resources Director today, Carl Von Hahn, and he said the signs are up. A couple are blown down over the weekend. He will get more signs up, but most of all the signs are up, and everything seems to be working very well at all the town boat ramps.
Board members, just so you're aware of, the decision was made, and as opposed to waiting until tonight or have an emergency meeting. So does anyone have any questions about it? We were basically following the governor's orders. So does anyone have any questions about it? It was a pretty extensive document that the health department received.
And you said that that was sent to us on email?
A separate
Is that what
email
you
came
said?
right afterwards. When the packet was sent out, it was a separate enclosure attachment.
Okay,
Pretty detailed. It was just trying to get things up and running. It, but if you did not get a chance to, we can certainly discuss it, certainly the next meeting after you get a chance to review it, Mary or anyone else for that matter.
that's fine. I mean, I trust that it was according to guidelines. I know
Yeah, it's a lot
Carl
of
is very
preparation.
responsible.
I'm sorry, Mary.
I just said, I know Carl is very responsible, so I'm sure it was done correctly.
Yeah, he was, very open to suggestions.
Uh-huh.
He's very well organized. There's a lot of work that has to be get done, ready for the season. So that's kind of why we moved ahead with it.
Mr. Chairman, if I might participate, Mr. Chairman?
Oh, anytime.
Thank you. So the State Department of Conservation and Recreation that oversees a number of the boat ramps throughout the state had put together a list of requirements and protective actions that should be followed. And that's what Carl is following and overseeing. And I think you'll find it's pretty comprehensive. It's on the State Department of Conservation and Recreation website. And not standing long, quickly loading and unloading and all of that. And Carl has all that info. So you're correct. It was well vetted. So he's got a good state plan.
Good. Thank you.
And it's certainly going to rely on residents from, following guidelines. That's what it'll come down to. So
Right.
let's be optimistic.
Okay, thank you, Mr. Chairman. Next on the agenda was just an update on the senior center grab-and-go bags. It's part of their daily program the seniors have worked out there where people can come through, grab a daily lunch. For the seniors, they're up to doing about 80 lunches every day, and that program's going very well up at the senior center. And they start at 12 o'clock and the cars go right through, and it works very well, and they probably go through in about 20 minutes. And it's a great program that they've been running up there. So I just wanted to bring that forward as a good positive program that's going within the town on that.
Bruce, how many people are they having come through?
80.
Do you know? 80.
They're doing 80 a day. It's increased a little bit, but they're right up to 80 a day right now.
Great.
This is separate than the Meals on Wheels or their
Right.
First Friday program. This is a separate program. The grab and go bags is a separate program that's working very well.
Good.
The other thing that's working very well is the community mask program. And I think we have a little, keep going. That's the face covering down further. There we go. This is a program the Board of Health started up in early April to get masks into the community, and it's going terrific. We have somebody assisting us. One of the board members has somebody assisting, and it's worked out. Hannah reached out into the community to ask people to make masks, and the community has really responded. And we've asked people to make masks for their friends and neighbors, and if they have extra masks, to bring them to the center. You can just scroll down. People leave the mask at the center, they're brought in, put in a bin for 3 days before they're put in a Ziploc bag for people to call in and ask for a mask.
Whatever.
We're putting them out on a priority basis, the people that need them, either
Need
home
more
quarantine or
steroids. I never thought I'd encourage you to do that.
So it's working well. People can call the senior center. They've given out approximately 200 masks. We're still looking for people in the community. If they're still making masks, we would welcome people, and we make them. We've had material donated, and some of them have the elastic ear loops that was donated. We had 200 feet of elastic donated by a building sale maker in town that worked out very well. So I just wanted to give the board how well that's worked out with a joint partnership between the Board of Health and the Senior Center. They're doing seniors center's doing a great job on coordinating, calling the people and taking the phone calls and getting the mask out. So that's a very successful program. Okay. Yeah. So next on the agenda, Mr. Chairman, I think is the golf course opening plan. And I think we can call that up. We do have on the conference Zoom right here, the golf director, Scott Gilmore. As we're aware, the governor came out with opening the golf courses last Thursday. Scott had been working on a opening plan. I had met with Scott a week before on a draft plan that he was working with. And pretty much everything that he was working with was within the governor's plan and within Mass Golf Association plan. So Scott was able to get that plan and operation plan to us. I could check it against the governor's orders and recommendations, which it complied with. And I met with him later that day, Thursday, went up there, looked at all the facilities, the markings, the separation distances, and approved it at that time. But I think Scott's on Zoom right now, and he can go over the plan and the points that's included.
That'd be great.
Might want to just zoom back so we can. Yeah. So Scott, if you could go over the what you've included in your plan, so the people that will know all the points.
Yeah, thanks, Bruce. Yeah, so when the state came out with guidelines, they came out with pretty extensive lists, about 19 guidelines, and we have a few more to keep everybody safe as we go through this. So a few of the main points is that we're requiring everybody to have a tee time. No one can walk up. In that, we're at 15 minutes apart. We're only doing credit card only to avoid points of contact. Right now, the buildings are closed, so we have it outside in a pretty good setup to keep everybody protected. We have the staff wearing face masks and gloves on the property. Golfers must stay in their car for 15 minutes until 15 minutes before their tee time. They have to return their car immediately following play. There's no more than 4 golfers per group. As I just mentioned, we have the clubhouse and the restaurants closed to the public, so nobody's going in the buildings at this time. We have signs posted, and we're telling people as well, all the players must stay at least 6 feet apart. We do have staff monitoring everything. We have a starter that's setting people off. We have a ranger going around to make sure it's being policed. We did open this weekend. We opened on Friday. Everything's actually going pretty well. People are adhering to the guidelines and are just pretty much happy to play. So they're all being pretty respectful with everything we got going on. When this was done, there was no golf carts allowed. That's been I sent that to Bruce over the weekend. That's been kind of lifted a little bit. We're still trying to get some clarity on that. There's no caddies allowed. We're not allowing for any club, push cart, or other equipment rentals. We also did the no touching of flag sticks rule. the pin must remain in the cup at all times. There's also a pool noodle in the cup so the ball doesn't go down in the hole. And then we're doing when you get the green, putt out, conditions putting rules to speed up a little play and not have any points of contact going between players. Another couple more here. All the golfers must use their own clubs. Sharing clubs is not allowed. I mentioned the foam insert. We have pretty much removed everything off the golf courses. No bunker rigs, ball washers, water stations, or garbage cans are out there. The restaurants are currently closed, and no pro shop merchandise can be sold at this time as we're closed. We're calling all patrons to wear face and mask coverings when they enter any building when that does get lifted. And the practice areas and driving ranges have been closed up per the guidelines from the governor. And then last thing, we do have hand sanitizer readily available. So it was a pretty extensive lift that the governor came out with, and then we added a few more to just further keep people safe at this time.
I have a question. You said face masks when and if the buildings are open. So right now you're not requiring patrons to wear face masks to play outside?
That's correct. If they're within can't stay within 6 feet or something, they have to wear the mask. But when they're out on the course, they actually do not have to wear the mask.
Okay.
I played the course, but I've never used the bathroom there. And I was just curious, are there any issues with using the bathroom and maintaining 6 feet of distance from one another? Or at that point, someone has to wear a mask on the way to the bathroom? Are there hallways? How do you tell how many stalls are there? Or
yeah, so the bathroom, we have the bathroom that's open. The one bathroom we have opened up, we have two. We have ladies and men's room opened up in the grill. We have a sign on the door that says one person at a time. It's part of the starter and the ranger's responsibility to police that. They're only letting one person in at a time. They are wearing the mask when they go in and use the bathroom and then leave. So only one person can go in at a time. We have the whole area blocked off so that you can only walk into the bathroom and walk out. So it's the way we have it set up currently. Bruce came up on, I think, Thursday afternoon to check it out to get everything squared away over there for the bathrooms.
Sounds very comprehensive. I think that's a lot of good work.
Scott, yeah, Pat, and Bruce, thank you. Coordinated effort. It was a lot to put together and get us out there and running. So,
Great. How'd it go over the weekend, Scott? I know the weather was okay, a little windy, but I'm sure everybody was anxious. It seemed to go well.
Yeah, no, it went really well. Friday was great. Everyone was really happy. It was a nice day. And Saturday was a bit of wind and rain in the morning, but still had people out there. I think people are just very happy to get out and play, and they've been very receptive to all the rules. And for most part, everybody's following. We haven't really seen anything outrageous or anything. People are just very happy to be out there and play.
Good. Well, have you heard anything else? We're hoping the governor in the next phase is going to allow golf carts and the range and the putting green to open. Hopefully that's in his next phase coming up, and you'll probably be hearing something from Mass Golf hopefully soon.
Yeah, they've been pretty good about providing daily updates. Like I said, I sent you that thing on the cards from the ADA and being in compliance there, but kind of a couple of loopholes there. But we're working with them and trying to figure out when the next kind of restriction might get lifted here. But right now we're just kind of maintaining as is the way we got it set up because it's working pretty well right now. Great.
How's appointment times? Are they getting pretty steady booking now?
Yeah. So with the 15-minute intervals, it kind of fills up the day pretty quickly because we lost half our tee sheet throughout the day. So, and we're very busy almost all day, every day because of that. So in the 15-minute intervals is working very well to spread people apart. There's no groups near each other on the golf course.
Okay, good. Well, hopefully the governor, when he goes to the next phase, will drop that down from 15 minutes, down to 11 or 12 or something.
Yeah, that would help a little bit. That's for sure, to get a little more people out there.
Great. Well, thanks for coming in, Mr. Chairman. I think he's followed a great plan and followed everything the governor has outlined, and it's working very well up there.
The last item there is on the Grady's Beach Boardwalk. And town manager had asked us to vote on it, whether or not it should be open or closed. Bruce, you have any comment on that? I mean, the history of it was closed because people were going out there and the beach was closed.
Correct, and we
Now,
had,
beach-
we had some
the beach is
complaints about
open.
how narrow it is. People were on there kind of, hard to get a social distance when you're walking back and forth, and then everybody would end up at the end. So, that's, up for the board to decide right now, with the social distancing, and should that be opened up now? I mean, we're still under a home advisory, or, at what thought, that could be considered when the board looks at, the opening beach plan, at next Monday's board meeting.
The Grace Beach Boardwalk was closed before the mask order was in place.
That's correct.
Correct.
Yeah, and now, and the mask order says that if you cannot maintain the 6 feet distancing, you should have a mask on in terms of being outdoors and around other people. How realistic is it if we were to open it up that people would be wearing masks on the boardwalk? And if we opened it up, could we say that? You must wear a mask if you're on the boardwalk.
We could look at signage. I know the town is starting to look at signage now, and that could be something, if appropriate signage could be posted. They have signage at the landfill when you drop off the landfill
Right.
or your recycles, and whether a sign could be made for social distancing and masking, and that's a possibility we could look into. See if that's something that the town could come up with.
I mean, would you consider that the boardwalk is part of the beach or not? That's one question.
I say it's not.
Okay.
I go on the boardwalk. I used to go on the boardwalk all the time, but I did almost never walked on the beach.
Okay.
For me, it was just part of my walk. The beach wasn't necessarily.
I sort of would consider it part of the beach myself. I mean, I don't know. When folks go down there, most of them are going down to walk out on the boardwalk. That's my personal feeling. I'm respectfully disagreeing, Mary.
I know it's busy. It's usually mob down there, and it's as it's hit some of the guidebooks of the best place to see a sunset on Cape Cod is off looking from that boardwalk. So it's crowded. So we can address it, whether it's part of the beach or not. It's questions, do we feel it should be open or closed? That's how I see it. Charlie, you have any thoughts on that?
I'm partial to open.
Okay.
It's definitely narrow. Obviously, we would want folks to be masked, if they were walking down it. I mean, it's tough to pass by too wide on that boardwalk. I think we know that.
Well, I get to watch every day the pass by at 2 or 3 wide here in my backyard on the bike path by the hundreds.
Yeah.
And some people are wearing masks, some people are not, but there's no big problem out there. I mean, I don't see the boardwalk being any different.
Well, if anyone make a decision tonight, we can take a vote on it. Otherwise, we can address it again next week. But the situation, I don't think is going to change down there, other than getting more people down there. So, any thoughts? People want to vote on this or not? If someone wants to, they can make a motion.
It should include signage, if depending whether you go forward, some type of signage requiring to wear a mask, and obviously no social gathering right now over 10. sometimes it gets a little crowded down there until hopefully the governor increases that number higher than 10, which would be helpful. So just a few
You
thoughts.
said-
on the board.
You said we're going to talk about the beaches at the next meeting? Or
Correct.
the Board of
Yes.
Selectmen are going to talk about it, or what's going on with that?
Well, we'll be on the Board of Health meeting next Monday to talk about the beach opening plan. They're working on it right now. Pat might have a few words, but they're looking at density, parking lot, and so forth. A couple of the towns on Cape are working together. We have a sign that Barnstable used that we're looking at. The Cape Cod County Health Department and Chamber Task Force is looking on it, and DPH is hoping to come out with some guidelines. So we should have something for the Board of Health to review so we can start looking at open the beaches as we get closer to Memorial Day. I think we should have a good plan that we could discuss next Monday at the Board of Health meeting.
Hopefully,
Then I would just hold off on the boardwalk, at least until then. I mean, people are still supposed to be sheltering at home, staying at home in their neighborhood. So I just as soon wait until we talk about the beaches in general.
may have more information from the Cape Cod Task Force as well, beaches on the Cape. I don't see any urgency on that decision. I don't know if it's still boarded off or not down there. Bruce, is the boardwalk still boarded up?
Last I looked at it over the weekend, yes, it was.
Okay. Pat, any comments?
Well, Mr. Chairman, there's a number of things happening. There's a local reopening committee being overseen by the chamber and a number of others. Mark Ells from the town of Barnstable, their town manager, is on that committee, and he has been taking recommendations and feeding the Cape and Islands Beach Managers Association with a number of articles as they're being discussed. I think Mary's right. It's kind of contiguous and connected to it. We're finding that they want to probably recommend to close every other parking space initially, take no cash, have one way in and one way out, and we don't have beaches that have two ways, so we'll have to figure out how to do that. I think they're working hard to do a plan that would be applicable not only to Yarmouth, but to Barnstable and Dennis on either side. I've been sending info to Bruce and to Dan Knappich and to Jeff Colby, because it's truly the DPW that handles the physical structure on the beach, and recreation, which is under my purview of community services, are the guards. I think we might need to expand to have some monitors to kind of help people learn this new system. I think there's some opportunities for making it happen, but the first phase, there'll be no cash. So there'll be no daily passes. You're going to have a sticker, or we're going to have to figure out a way of having an app online where you can buy your pass and show it at the gate, kind of like what you do with your plane ticket. But we're not American Airlines, thank God. So we're going to have to figure some of that out. But we're trying to stay ahead of it and look at what we've got for our resources. Very proud of Scott. He has set a wonderful standard of implementation from the limited but really clear and restrictive rules that the state's bringing down in phase one. Beaches will be next, and we have a plan, and we'll see how it can be adjusted based on the governor's recommendations and dictates. And then we also have that same plan for opening parks and playgrounds, for having summer camps. We're all working hard to have a multitude of things queued up, so when we get our instructions, we are able to move forward. The Community Services Department, which includes Senior Services, which is doing, as Bruce has shared, the mask program, and also Libraries, which is working hand in hand with them. We're all working together along with recreation and golf and natural resources. So we're ready when the instruction comes. And I know people are going to want, as in golf, today he announced it and tomorrow we can be on the course. That's just not realistic for some opportunities. So we're trying to prepare the best we can, so that time between when it's announced on the 18th and when we have to implement, be it June or July or whenever, we can do the right things to protect everyone. But we've been working Saturday and Sunday along with the group, the reopening group, and we're every day changing our plan and modifying it. So, and I'll make sure that Bruce knows, and with that, you, Mr. Chairman, and the others here on the health board will know what's going on. And tomorrow it could be a whole new scenario. So just forgive us as we work to try to do the best we can.
Thank you for the effort.
Sounds good, Pat.
Thank you.
Okay. You know, there've been several really important new developments, I think, in town, like just the COVID response. And, you know, we as a board haven't had a chance to go over them. I'm sure people are probably learning about it by reading the newspaper. And I just want to go over Timetable a little bit, what's taken place so far. And the first date I think was significant was April 28th. And that's when the Board of Selectmen opened Homer Park, despite an order placed by the Board of Health to close the town park. So on that day, that order was in effect, and the parks were closed. So currently, there are no restricted areas at Homer Park, and that's including the playground. Next date I just want to point out was May 4th. And that's the day I emailed the town manager, Director Murphy, and Michael Stone, the chair of the Board of Selectmen. And I suggest that the four of us meet and coordinate our efforts and work proactively, just addressing the expected summer crowds. Director Murphy responded promptly and agreed meeting would be in the best interest of the public. I haven't heard back yet from the town manager or from Chairman Stone. The next date was on May 7th, I think was important. The town manager requested the Department of Public Works to take down the beach closure signs, and he felt that was consistent with the vote of the selectmen, which I understand. The following day, I heard from the DPW and wanted to know whether the new signage that would go on the beaches would be acceptable. And I said, I'd bring that up to the Board of Health tonight. And that's something we can talk about tonight. I need to point out that a picture of the new signs was posted over the weekend already on the town's Facebook page. So I don't know if it's academic to be discussing these new signs or not. I don't know if anyone has seen them.
I haven't.
You have not.
What do they say?
They're easy to read. They're well written. But the decision looks like it's probably been made. Obviously, it's in conflict with the order to close the beaches, which we made, so it's complicated. Anyone else by chance been online over the weekend and perhaps saw the signs?
I don't do Facebook, so I wouldn't be able to see them anyway.
Okay.
Mr. Chairman, our town administrator is on the meeting and like to speak.
Oh, sure, absolutely, great.
Good evening. How are you?
Fine, thanks, sir. How about you?
Good. So the signs that we presently are representing are borrowed in part from what Barnstable had posted. We added those signs in Barnstable were posted. They include information on social distancing and washing your hands, and they were created by Barnstable back in the beginning of this. We added, consistent with the governor's face covering order, we added information on the face covering. So one of the reasons why we were waiting to have the meeting with the chairman is because the beach opening rules that Director Armstrong had spoke to have not really been finalized yet. We just got a draft late last week. And now that we know a little bit more about what the future looks like, I didn't want to have a meeting and waste people's time on speculation on things that we didn't know anything about. But now we know a lot more about what the order is going to look like. So I would say to the chairman, I can reach out to Mr. Stone as our meeting tomorrow night. And certainly I believe after listening to the governor today, by later this week, we'll have a better understanding of exactly what kind of guidance and latitude the state's going to give us on that. We can start having that conversation either late this week or early next week, but certainly before Memorial Day. But part of the challenge from managing these things is the, decisions are needing to be made in real time and react to things, but guidance on what to do so we don't give the public mixed messages is sometimes slow to come. But today, there was a fair amount of information that just started to get released from the state related to universal precautions needed to be taken at all workplaces. So this is a start. And as we catch up to that, much like when the golf rules were announced and came out overnight, we'll put a plan forward together so both the Board of Health and the Select Board can review those. I plan on taking those return to work plans that were reviewed by the board tonight and presenting them to the Board of Selectmen tomorrow. But this has been our challenge, has been sometimes the slowness in which information comes to us, but then when it decides that it's going to come, it comes very fast, and people are expecting a snappy answer in today's day and age, and it doesn't always happen that way.
Okay, thank you.
So the beaches in town are open though?
They are open, that's correct. That's consistent with the selectman's order to me last week.
That was on May 11th. Board of Selectmen
May 5th, I think it was.
voted, I'm sorry,
May 5th?
May 5th.
Fifth,
Okay.
yeah.
So so essentially it opened the Yarmouth beaches, and that once again is despite our order to close the beaches. It's hard to know where that stands, essentially. The board decided, Board of Selectmen, to close to not close the parking lots. So basically the beaches and the parking lots are open. What we had done, we had closed the beaches and not the parking lots. That would allow someone wanting to go down to the beaches, sit in their car and watch the sun either come up or down. We handled it a little differently than the other towns. A lot of them had closed parking lots, which essentially made the beaches only available to the lucky ones who live near the beach, where you could walk to the beach. And the rest of the people really didn't have access to the beach because they needed to park their car somewhere. So right now, I guess we have absolutely no restrictions. The parking lots are open, the beaches are open.
So then this work that Pat told us about that's being done, what's going to happen when their recommendations come forth and we have had completely open beaches with no restrictions other than the signs saying that there should be social distancing and masking if that's not possible and people should wash their hands? I mean, how is that going to be received?
Well, I would say that's unknown. I mean, we haven't seen the plans yet for the opening of it. I can imagine there are going to be several issues, significant ones,
Right.
as the crowds start coming in. You read now a lot of beaches are closing after they're open in other locations. We'll see what happens here. Once again, I point out right now we put an order in to close the beaches. So that's where that stands from our standpoint of view, certainly not from the selectmen's standpoint. What will happen that first day, I don't know. Hopefully their plan takes that into account. What do you do when people are not respecting distance from other people or the wearing a face mask? It's complicated to look at that. If you have a family or group of people together, it's hard to know.
Right, exactly.
I'm sorry, Mary, what?
No, I said exactly. It is difficult to know, are these people that are living together anyway, and so this is okay or not? And, I've been reading about some other places that are closing their beaches again now because they're finding that people are not respecting the restrictions that have been put on activity at the beach. So it's troubling, I think. It's difficult because the beaches are a big part of our economy, a big attraction for people. People are going to want to come to the Cape. It's close. They're used to it. It's going to be very difficult. I just worry that we might have more infections because we're going to have some big crowds of people.
Yeah, this is part of the reason why we closed the beaches. It's only going to get more difficult.
Right.
Coronavirus, by history, transmission goes up when population goes up.
Right. We're other countries now that have opened up are now closing up some of their crowded venues because they're finding that it is coming up again. So, well, in any case, we'll just have to see what happens. We tried.
Right. The Board of Health has broad, authority to protect the public, and that's what we were attempting to do. I think the letter from town council stated pretty clearly that we all looked at, and that a judge would not overrule decisions that we've made. It's probably based upon Yarmouth is in the middle of a health crisis as well. The whole world is right now, and that's probably why a judge would not overrule decisions we've made.
I just hope going forward that we can do a better job working more closely with the Board of Selectmen, because I think it's disappointing that it has come to this.
I agree. I can only state again, I reached out and really haven't heard. I had a long conversation with the chairman of Selectman Stone, and so I'm waiting. That's all. I think I think the Board of Health has reached out. But the bottom line is, the Board of Selectmen has started to take actions on health issues and bypassing the expertise of us. That's what's taken place. And it's only my personal feeling is that, the health of Yarmouth residents is really falling now upon, the shoulders of the selectmen. They're essentially making decisions on their own. We certainly need to discuss this further. We certainly can do it tonight and again, our next meeting. Any suggestions from other board members? Comments?
Personally, I think the board should have talked to the selectmen before they closed the beaches the first time. But that's only me.
Anyone else?
I don't know as I'm comfortable necessarily challenging the Board of Selectmen. I really don't have knowledge as to what that would look like and how that would play out.
I agree. I'm not suggesting we take them to court. No, absolutely not. It gets complicated in enforcement of orders, and we're going to find that, I'm sure, over the summer.
Yeah,
Be a big issue, and that's not something we have any control over. It's going to be challenging.
And we are appointed by the Board of Selectmen. The Board of Health members are appointed by the Board of Selectmen.
That's correct. We're volunteers.
Yeah. Well, these are dark times in many ways, and I think that we can do better going forward, and hope that we will.
I agree. Director Murphy, do we have some new or old business to discuss?
No, I think you've covered the agenda tonight, and next meeting will be next Monday, at which time one of the things on the agenda will be opening the beach opening plan, and anything else that might come up from the governor's order this week. I'm sure we'll be hearing from the governors on opening up motels, inns, how that's going to unfold, restaurants, hopefully the indoor seating, outdoor seating. So hopefully we'll be getting more directions to go forward with that as we get closer to getting things open by Memorial Day. So I think the big thing will be any discussions like that we might be able to bring to the Board of Health, but definitely discussions on the beach opening guidelines that the board could look at for next Monday.
Okay, sounds good.
Bruce, can I ask, I know this really hasn't been discussed, as a board previously, but can I ask where the town stands with the waste oil disposal at the transfer station?
Yes, I know you brought that to our attention. We did look into that receiving the waste oil has been down probably for over a month, 2 months now. They're looking at it. I think there was a contamination issue.
I think it's been over 2 months.
Yes, yes.
Yeah.
So we have reached out to DPW up there about what their status is. I know there's going to be a cost if they had to pump it out and so forth. But we've asked them to try to get that back online as soon as they can, so people can bring their waste oil, whether they're changing their car oil or lawnmower oil or boat oil, they can bring that up there. It's important. I know you can bring your waste oil back to a place that you bought it from, but you need to have the sales slip, so it's difficult. I think the best way is that we've had it up the landfill for many years is to trying to get it back up and running again. And we'll check with them this week and try to give you an update next week at the meeting.
Okay. Yeah, I'm just kind of concerned about, I just don't want it to be disposed of irresponsibly, and it's been closed for some time now. So just kind of curious as to what's, I have no knowledge as to what's involved in cleaning the tank or getting a new tank, things like that. But certainly nice to have some updates on that. That's all, So I appreciate you guys looking into it for sure.
Good. We'll get an update on that for you. And also on the agenda next Monday will be the annual review of the railroad spraying. And we'll look at that. Kyle's looking at that this week. It started a little last week, and we'll have a draft recommendations, kind of what the Board of Health has done the last couple of years with the concern of pesticides being sprayed within town. And we'll draft up a letter for the board to discuss next Monday also.
Thank you. So the goats are out then. We're not going that direction this year.
Correct.
Okay. Anybody else? If not, someone can make a motion and we can adjourn. Somebody go for it.
I move.
I'll make a motion to adjourn the meeting.
Is there a second?
Second.
Okay, if you're in favor, just say aye and give your name at the same time. I'll say
Aye,
Aye,
aye.
Mary Craig.
That's two.
Aye, Eric Weston.
Charlie, you home?
Aye, Charles Hallway.
Okay, meeting's adjourned. Thank you, everyone.
Thank you.
Be well.